Thank you so much, Mr. Balkrishnan Shankar, Dean of the School of Engineering, Amrita Vishwavidyapeetham, and Mr. Ram Ganapathi, who's the CMO of Amrita Hospital, Faridabad, for joining us. The subject matter that we are discussing today is advancing India's engineering and medical prowess. I want to start with you, Mr. Balkrishnan, and let me start by asking you, some of the hot topics on discussion are IoT, AI, machine learning, robotics, cloud computing, big data. How is this really impacting on the entire startup creation here in India? Can you explain to us, because, we see all this talk about unicorns, startups, so on and so forth. How do you, sitting as the dean of this engineering department, look at all of this impacting upon our education and also in terms of opportunities here in India?
Thank you. So thank you for inviting us over here to give us the opportunity. That's a very important question. And AI and, big data, cloud computing, and especially AI has, invaded practically in every field that we know. Whether it is in health, in automation, in technologies, in materials, and everything that we know. So definitely that has changed the startup scene. So India has several startups, like Qtrim, like fintech, like Cure AI, etc. But then at the same time, the fact that AI tools and technologies are now available for students. We have a variety of programs like we have in computer science and AI, we have a new program, robotics and AI, several programs that we offer. That skill set has greatly enabled the startup scene. We have students coming up now, even in first year and second year, with ideas to start new companies. And so that has really changed the scene. And I think that as the years go by, we are going to see a lot of new startups in India in different domains. Right from, for example, I had a first year student who came to me with an idea to start a company using AI to generate new food recipes, to mix recipes from North India and South India and other countries and to make new food recipes. I had students come and start AI and health companies to develop AI for predictive analytical health. And we have programs and research centers that do the same thing. So definitely, to answer your question, it's coming in a big way, and you're going to see a lot of startups in India coming from the AI sector.
But can AI ensure that the food tastes good if you're mixing North and South? That's a big question.
Pardon me?
I said, can AI ensure that the food tastes good if you're mixing North and South?
Actually, you'll be surprised, yes, because there's a lot of data behind that. There's a lot of data and survey that goes in behind that, and let's hope so. He has not yet gone public, but let us hope so, yes.
Right. If I can come across to Mr. Ram Ganapathi, take us through the steps that you're taking to ensure healthcare education and also in terms of empowering future Indian professionals in the healthcare industry is concerned. What are the efforts that are being taken?
Thank you. Thank you very much for this opportunity. So Amrita Hospitals, the one that's here in Faridabad, that's been in operation for the past a year and a half, and the one that's in Kochi, Kerala, that's been in operation for more than 25 years, have always been focused on innovation. And because we have educational institutions associated with the hospitals, we also can facilitate cross-departmental research on an ongoing basis, right? Let me give you an example, Madhav. So during COVID, if you can remember, it was very difficult to access good quality masks. The best mask that was effective was supposedly the N95 that was available only in the US, and it was very expensive. So our nanotechnology department worked together with the clinical department of the hospital to develop a mask that was significantly more effective than the N95 at a very, very reduced cost. So this is the hallmark of our research projects that we do at Amrita, where the net result is going to be beneficial for the society, but at very economical levels. Now, having said that, with respect to the doctors on an ongoing basis, we always have what is known as a CME, a continuing medical education conferences, where they participate and to keep abreast of what's happening in their fields, where international faculty are invited to share their experience and knowledge, and that's one way to do, they keep innovating in their field as well. As far as students are concerned, we give them a well-rounded education that is value-based so that they can become good clinicians. Now, what is value-based education? Just like Amma, my Guru Sri Mata Amritanandamayi Devi says, there are two-way educations in life. One is education for a living, and the other one is education for life. The first one is when you get a degree certificate, you get a job, that's your education for living. But what is education for life? Where you are taught values, things like compassion, which you can then use to become a better citizen in the society, right? So this is what we do as part of our overall innovation and curriculum and innovation and foster that as both for our faculty and for the students.
Right. One of the questions, or one of the things that's spoken about a lot is skill development. Of course, the Indian education system, there's many things that many would say, A-late, there are many scopes or areas of improvement. But, the skill development is one area where you look at how the requirements are there in a society, in a particular given economy, and then you train the students according to those requirements. How do you see this actually panning out or even picking up in coming years, and how far have we actually achieved in this particular department, would you say?
Okay. Skill development is something huge. And to go beyond the curriculum, it is no longer enough to, sit in a classroom, learn from a textbook and pass the exam. Okay. You need to have skills. The kind of skills that an engineer needed 10 years ago, you could predict it. But now in this rapidly changing landscape, it's much more difficult to predict what kind of skills a person really needs. But with disruptive technologies like in AI, robotics, IoT, cloud computing, big data, coding, these are the skills that are going to be needed. And this skill development is what we focus on in Amrita. So what we do is we have project-based courses. We have flipped classrooms. Classrooms where students tackle real life problems. That helps in the skill development. For example, a mechanical engineering student who has AI skills will be hugely employable, because what he's going to be able to do is translate his expertise in a huge variety of tasks. So in this context, when you talk about skill development, there are two types. One is technical skills, the other is soft skills. So both are very important. So in Amrita, we have something called Live-in Labs. It is a humongously popular program which recently started with Amma's vision. We've adopted around 100 villages across the country. Our students actually, they take this as an elective. They go to the village and they identify what is the main problem in that village and come back and work on a cost-effective solution for that.
Mr. Ganapathi, you spoke about, of course, the spiritual side of things and values, but we're also talking about a situation where there is much talk about Industry 4.0. How do you prepare students for future unforeseen situations, for instance, is something that is spoken about a lot. Can you take us through your own experience?
Sure. It's probably going to be a continuation to what Dr. Bala said. You need the doctors and the medical students to be aware of the technological innovations that are happening and the need to be in a position where they need to use them. So let me take AI as an example, right? We have started a program where we are giving training to the doctors at Amrita Hospital and the students on AI and medicine, right? Where they need to be aware of what is happening in the technological side. If I can take an example, right? Let's say I'm a patient that I'm going to see a doctor, right? And I know about ChatGPT, right? So I'm at home, I know what my symptoms are, I look up what the potential diagnosis needs to be, and I go to the doctor and I tell the doctor what my symptoms are, and then I tell the doctor what his or her diagnosis should be to me because of what I looked up. So we don't want the doctor to be in a situation where they are flummoxed by the what is happening. So they need to be aware of where the patient is coming up with such knowledge.
I think you're giving a lot of people a lot of ideas right now.
Please don't do that. Let the doctors do their work. But they need to be aware of that. So we are training them, right? The second one is, again, Dr. Bala talked about simulation. At Amrita Hospital, Faridabad, we have a very large simulator set up for students, right? Why do we have that? When you have 100, 150 students in a class, it becomes rather difficult for them to access resources where they can do hands-on training, because we may not have cadavers available to us to serve all the students. So then they are able to use the simulator, very similar to pilots using flight simulators to learn how to fly. They use the simulator, work on dummies, and get the hands-on experience that they need for pursuing their education.